How long are you observing your patients with anaphylaxis after giving epinephrine? We know that epinephrine is the only critical medication in the treatment of anaphylaxis. 0.5 milligrams IM is the dose we should be using, and we always keep in our heads the mantra, if A, B, or C, give E. If any compromise to airway, breathing, or circulation, give epinephrine. But after we give that epi and the patient improves, how long should we watch them for? The reason to observe these patients is to look out for the dreaded biphasic reaction. Patient improves, epi wears off, and then that patient re-anaphylaxes. The traditional teaching is to watch these patients for about 6 hours, but there's no reason to watch them for that long. First off, biphasic reactions are extremely rare. They occur in about 0.2% of cases. That's 2 in 1,000 cases of anaphylaxis. And the data shows that these biphasic reactions can occur up to days out. So watching the patient for 6 hours doesn't make a lot of sense. What I do is watch the patient for 2 hours after their improvement. That gives enough time for that dose of epi to wear off to see if the patient is that rare early biphasic reaction, and it gives me time to teach the patient how to use an epi autoinjector, which of course I'm going to be sending them home with. It's also worth noting that we typically will send these patients home with a course of steroids to reduce the risk of that biphasic reaction, but there's no data showing that that is an effective strategy. Just keep that in mind when you're weighing the risks and benefits of steroids.